Good day, everyone. I am Vanessa Rosales, a medical technology student of Tuan Doctors College. This is my case study about Huntington disease. Huntington's disease is a fatal genetic disorder that causes the progressive breakdown of nerve cells in the brain. It deteriorates a person's physical and mental abilities, usually during their prime working years, and has no cure. Huntington's disease is known as the quintessential family disease because every child of a parent with Huntington disease has a 50-50 chance of inheriting faulty gene. Today, there are approximately 41,000 symptomatic Americans and more than 200,000 at risk of inheriting the disease. Huntington's disease was first recognized as an inherited disorder in 1872 when a 22-year-old American doctor, George Huntington, wrote a paper called On Korea. His paper was later published in the Medical and Surgical Reporter of Philadelphia, and the disorder he described became known as Huntington's chorea. Chorea comes from the Latin and Greek word meaning chorus, or a group of dancers. The term was given to many so-called dancing disorders that became noticed in the Middle Ages. In those days, people with chorea, like the involuntary muscle jerks and twitches characteristics of Huntington disease, were often thought to be possessed by devils. It is believed that at least one of the alleged witches executed in Salem, Massachusetts in 1960s had Huntington disease. Today, the term Huntington's disease is more commonly used than Huntington's chorea. Throughout the 18th and 19th centuries, chronic adult hereditary chorea was poorly understood because of people who had the Huntington disease gene died before the symptoms could develop. Now that we live longer, the Huntington disease has more time to express itself. The discovery of the gene in 1993 was a major milestone in the history of Huntington disease. The specific community worked very hard to find the gene, and the process was long and tedious, requiring great patience and perseverance. Nevertheless, the job is not over until an effective treatment is found. The scientists working on Huntington's disease today are brilliant and passionately committed to finding a cure. It's hoped one day researchers will find the answer to the puzzle of Huntington disease, and support groups like the association will no longer have to exist. Until then, support groups worldwide will continue to raise money for research, support services, and an improved awareness and understanding of Huntington disease in the wider community. Definition of terms. Pathophysiology.
Welcome to 2-Minute Neuroscience, where I explain neuroscience topics in 2 minutes or less. In this installment, I will discuss Huntington's disease. The symptoms of Huntington's disease typically emerge during middle age, and at first often involve subtle changes in personality, cognition, and movement. Eventually, the symptoms progress into substantial movement problems, like chorea, which involves uncontrolled spasmodic movements, impaired coordination and balance, muscle rigidity, and difficulty speaking and/or swallowing. Cognitive and psychiatric symptoms like dementia and depression occur as well. The disease is incurable and fatal. These symptoms are associated with neurodegeneration, or the deterioration and death of neurons. A group of structures called the basal ganglia are strongly affected, but other regions of the brain experience neurodegeneration as well. The pathology of Huntington's disease can be traced back to a mutation in a single gene called Huntington. The mutation that causes Huntington's disease is a dominant mutation. Thus, if one parent has the disease, their child has a 50% chance of developing it too. The Huntington gene contains a DNA sequence that consists of 3 nucleotides, cytosine, adenine, and guanine, in repetition, a pattern known as a trinucleotide repeat. When the gene is mutated, an excess number of repeats can occur, and a mutated form of Huntington protein is created. The higher the number of repeats, the greater the risk of disease, and all people with 40 or more repeats in the Huntington gene will develop Huntington's disease. Mutated Huntington proteins have a tendency to group together, forming clusters within neurons that are not easily removed by brain enzymes. It has been hypothesized these clusters may play a role in the neurodegeneration seen in Huntington's disease, for their accumulation in the brain is associated with increased neurodegeneration.
Epidemiology. The epidemiology of Huntington disease thus depends on the ascertainment of individuals with the expanded CAG mutation, and on examination of clinical signs to accurately assess disease onset. A larger number of individuals has an expanded CAG repeat than actively manifest the disease due to adult onset in the majority of cases. Because of incomplete penetrance at the lower end of the pathogenic CAG repeat range, the frequency of the expanded CAG repeat in the general population may be higher than previously thought. Genetic differences and changing demographics may account for geographic and ethnic variation in the prevalence of Huntington disease between populations and over time. Signs and symptoms. The signs and symptoms of Huntington disease develop insidiously, starting from about age of 35 to 40, depending on phenotype severity. Dementia or psychiatric disturbances develop before or simultaneously with the movement disorder. These symptoms predispose patients to suicidal ideation and suicide, which are much more common among patients with Huntington disease than among the general population. Abnormal movement appear. They include chorea, athetosis, myoclonic jerks, and pseudotics. Tourette refers to Tourette-like symptoms that result from another neurological disorder or use of a drug. Touretteism also includes the repetitive gestural movements and phonatory sounds that patients with chorea make. Unlike through tics, the pseudotics of Huntington disease cannot be suppressed. Typical features include a bizarre, puppet-like gait, facial grimacing, inability to intentionally move the eyes quickly without blinking or head thrusting, and inability to sustain a motor act, such as tongue protrusion or grasping. Huntington disease progresses, making walking impossibly and swallowing difficult. It results in severe dementia. Most patients eventually require institutionalization. Death usually occurs 13 to 15 years after symptoms begin. Diagnostic workup. A neurologist will perform a physical exam. They will look for twitches and jerking, as well as problems with your balance, reflexes, and coordination. Your neurologist will also want to know if anyone else in your family has the disease. You will have tests to rule out other conditions that cause similar symptoms and to confirm an HD diagnosis. Tests include blood tests, genetic testing, imaging tests such as magnetic resonance imaging or MRI, and computed tomography or CT scan. Treatments. There is no treatment to stop or reverse Huntington disease. However, there are some medications that can help keep symptoms under control. Treatment for Huntington disease includes the drug tetrabenazine, antipsychotic drugs, antidepressants, and tranquilizers. Patients who exercise tend to do better than those who do not.